So, what happens next after today? You should already have a questionnaire to fill in. If you don't, then please contact the department and they'll send you one out. If you're interested in what you've heard today and would like to go further with our department, then please fill in the questionnaire and return it to us within 4 weeks. Then you will be booked for a one-to-one assessment with one of the therapists. At that appointment, we will agree on a plan, which will consist of attending or doing workshops in some various ways. After attending or working through workshop material, you will have a review appointment with one of the therapists, preferably the one that you had the assessment with for continuity. We offer 5 workshops, but the most anyone does is 4, because as you can see, workshop 3 is for people who are in work, and workshop 4 is for those who aren't in work. Each workshop builds on the strategies of awareness, coming to terms with your situation and your condition, understanding things better so that you can again manage and cope better, and they all also include a brief relaxation. So let's specifically talk about workshop 1. This particular workshop builds on the strategies of pacing, sleep hygiene, lifestyle, so our habits around diet, hydration, so are we eating right, are we drinking enough water? And then let's talk about workshop 2. This workshop builds on the strategies of mood management, relaxation, the concept of self-kindness or self-compassion, and mindfulness, as well as looking at ways that we can distract and how do we communicate with not just our loved ones or people who are close to us, but also maybe at work. And let's go on to talk about workshop 3. This workshop will help you consider your workplace rights and responsibilities. We will explore our attitudes to working when we have pain and its effect on your functioning at work. We'll also look at the responsibilities of your employers and link those to employment law. There will be options outlined to signpost participants for additional support and advice within that workshop too, as we know that workplaces can be quite complex. But the workshop aims to help participants consider what adjustments could be made at work and perhaps outside of work that may help them manage things better, such as how to apply pain management strategies in a work context and with your work colleagues. So let's talk about workshop 4. This workshop will involve you in reflecting about what your current functioning is like and your satisfaction with this since pain has entered your life. There will be individual exploration about what could change in terms of your roles, your interests, and future in order to help you manage your pain and functioning as optimally as possible. We will consider the relevance of having an occupationally balanced lifestyle, exploring the benefits of self-care, our leisure interests, and productivity time. There again will be support and information regarding setting your own SMART goals for your future rehabilitation. We will look at factors that will influence our progress or your progress and motivation. And finally, let's have a look at workshop 5. So this workshop will involve recapping on the current scientific understanding of chronic pain, building on what you've heard today. It will cover fear avoidance and how your thoughts and feelings around a certain activity or movement can affect your behaviour and how you move. The session will explore how you can begin to get more active, working with your chronic pain. The workshop will aid your understanding around your body, and it will begin to explore any adaptations that you have made since your pain has come along. It will highlight the key benefits of getting active and how to apply pacing to activity so that increasing your activity levels is achievable whilst managing your persistent pain. The session will also cover setting an activity goal, which is really quite important to take things forward after the workshop itself. And here's a short video to recap on what we've discussed so far. It's produced by the Australian Health Board, but we don't think we're too dissimilar from the Australians.
Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work. Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic, because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed as well as they can be by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's best to get a second opinion, and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed, many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best, and you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain and it can be retrained, and when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So get a helping hand if you need it, set a goal and begin.
And finally, here's also Dr. Aurora, one of our consultant clinicians, closing the session for you today.
Thank you today for coming to the pain management education session. I hope you found this session beneficial. Otherwise, it might have been a comprehensive refresher for you. I would encourage you to engage with the biopsychosocial approach of pain management, because that will provide you with long-term pain management skills.
Okay, and just to recap what happens after today, please send us back your filled-in questionnaire within the next 4 weeks. Thank you for staying with us in this presentation. If you have any questions, then please write them down, bring them up at your therapy assessment, and we'll do our best to answer them and work through that with you. Thank you again for attending, and we look forward to hearing from you. Thanks.